Good morning to all our major partners, CHDs, and everyone who is watching on YouTube. I'm Jolo from the DOH Communications Management Unit. And in our Kapihan today, Tuesday, we'll have updates on COVID Kaya. Here with us today is Director Althea de Guzman from the DOH Epidemiology Bureau. Good morning po, Dr. Thea.
Morning, Jola, and good morning to all our media partners.
You may start na po, Dr. Thea.
Okay, sige po. I also have with me the heads of our data analytics section, Ms. Angelica Garcia, as well as the head of our database manager. And again, thank you to the CMU and to our media partners for the opportunity po to better explain paano ba saan ba nanggagaling yung datos ng Department of Health at na ilalabas natin on a daily basis into COVID-19 case bulletin, at ano po yung mga proseso na ginagawa natin, and how has technical issues with COVID Kaya impacted yung ating daily numbers. Simulan ko dito na ang COVID Kaya is actually, in a way, a repository of several data sources. Doon pumapasok yung ating case data. And when I talk about case data, may iba't ibang parang klase ng case data yon. Una, we get case data from the CDRS or our COVID-19 Document Repository System. Ito po yung pinag-uploadan ng mga laboratory results ng ating mga RT-PCR laboratory facilities, the results as well as the line list of both positive and negative na mga individuals on RT-PCR. At yung term namin, ino-automated push siya. So pagpasok kay CDRS, dapat papasok na din siya kay COVID Kaya. At ito yung source natin ng datos kung sino ba yung mga bagong kaso natin. Papasok din kay COVID Kaya yung mga ine-encode, either ng ating mga disease reporting units, ng RESU, ng SESU, or even our own encoders here at the Epidemiology Bureau, yung mga line list, para saan yung mga line list ng RESU at SESU. Ang nakukuha nating impormasyon dyan ay una, yung mga bago pa rin nating kaso, dahil kadalasan sila naman yung unang nakakahanap, yung mga LGU, mga hospital natin, sila yung unang nakakakita sa mga kaso. So yung profile, yung datos ng kaso, ang naipapasok ba galing dito sa mga line list na to. At dagdag na nakukuha natin sa mga line list ay yung updates. So halimbawa, baka ngayon mild lamang siya, posibleng sa susunod na mga araw o linggo naging moderate, naging severe. So that's health status. O di kaya pag nalaman na nila na positive pala itong individual na to, ina-update nila yung other case information like onset of illness, ano yung tunay na address, ano yung other contact details. At yung isang update na hinahanap din natin, tinatawag nating outcomes. Sino ba sa mga na-report na kaso natin ang naiiwang active, meaning sila ay mga naka-admit at naka-isolate pa, at sino din yung mga posibleng naging fatality na or recoveries na. So ito yung nakukuha natin sa line list, at dagdag dyan yung ating DOH, data collect, yung death module natin.
Diyan mga itali si Cookie sa ano?
Meron pong mga
Okay.
Okay, thank you. And then the last is of course our case investigation forms na meron tayong posibleng iba pang datos na naipapasok, So all of these from the laboratory and the individual case data either is automatically pushed into COVID Kaya or is manually encoded into COVID Kaya. All of these gets transferred into a data warehouse. So mahalaga yung data warehouse na yon para sa Epidemiology Bureau because it makes it easier for us to access data. We're not just talking about hundreds or thousands of records now. We're talking about millions, And it makes it easier for us na hindi siya lahat yung usual na manual extraction, downloading, at doon pa lang namin nililinis ang datos. And from this data warehouse, kapag nabuo na yung line list, kapag tayo na-extract natin ang datos mula sa COVID Kaya, Lilinisin siya, tatanggalin natin yung mga kilala natin o na-identify natin na mga duplicates. At the same time, inaayos natin yung format ng ating line list. At kapag yan ay nabuo na natin into a case line list, yan po yung ina-upload naman natin sa data drop. Ito yung na-access na po publicly through the DOH website where we just remove unique identifiers, yung mga pangalan po. Pero basically, this is the line list of our confirmed cases. Now, I'd like to just go through na ito yung mga dinadaanan na proseso mula sa pumasok siya kay COVID kaya hanggang sa siya ay mailibas natin as a report. So, when we talk about extraction, it talks about us getting the data, all of the records in COVID kaya. No? So, bagong kaso, dati na natin mga na-report na kaso, ito yung kinukuha natin kay COVID kaya. No? Yun ay nililinis, so there are different ways to pre-process and I'll let Johnny explain this later. Pero when we talk about pre-processing to deduplication to post-processing, what it basically do is remove the duplicates and reformat the case line list para siya ay, ito na yung magiging final line list na natin. No? It undergoes further cleaning and validation. For example, especially for deaths, they need to fulfill several criteria and I will expound on this later bago natin talaga sila ma-count as deaths. And after we have that finalized case line list, ito na yung nire-release natin una, yung datos as a case bulletin. And then internally, all of the analysis, no, the surveillance reports na generate ng Epidemiology Bureau ng COVID-19 surveillance and quick action for its stakeholders. And then yung public facing niya is the data drop at yung nakikita natin sa DOH website. So yung extraction ay nagsisimula at ginagawa natin kada alauna araw-araw. No? So nabanggit nga natin dito, pina-process or pina-format muna siya. The next step after ma-reformat or maiayos lamang yung format is ito ang paghahanap ng duplicates. So internally, there are two ways where we identify duplicates. Meron tayong mga nakikita na eksakto, no? Yung pangalan, yung birthday, yung kanilang address, eksakto. And these are what we call exact or strict duplicates. Meron din naman tayo mga tinatawag na fuzzy or parang sounds like na mga duplicates. Pwedeng tulad ko, pangalan ko ay madalas na namamali ng spelling. So, Althea and Alethea. So, hinihiwalay yun. Pag exact duplicate, we can already remove them. But the fuzzy duplicates or yung parang sounds like, ito yung iniisa-isa ng ating database managers at inaalam sino doon yung kailangan at pwede na nating i-drop at sino doon yung hindi mo na natin tatanggalin as a duplicate at ine-endorso natin yan sa ating mga epidemiology and surveillance units para sabihin, tunay ba na duplicate to? Kasi kung tunay, tatanggalin namin. Or kung sabihin nyo na hindi, magkaibang tao yun, iiwan natin yan no, sa line list natin. Hindi natin tatanggalin yung akala natin ng mga duplicates. No? At so lahat ng mga tinag natin as the duplicates, tinatanggalan na natin yan sa ating line list. And then the last, so tulad nga na bagkit natin, they check it for consistency and validity. So sometimes we receive reports na bakit kahapon death na siya, ngayon tinatag nila as recovery, o di kaya recovery kahapon, biglang death or naging active siya. So ito ang iniisa, no, kapag merong mga ganong inconsistency, chine-check siya ng database managers natin. And if internally we can already clarify or at least ma-determine alin doon yung valid na data, iiwan natin yan. Doon sa mga kailangan pa ng further validation, yan nga yung tulad ng mga duplicates natin, nire-refer natin siya sa ating mga ESU para sabihin sa atin which of these two information ang valid, no, or yung tunay. And the last thing that we do for that line list is upload it, no, to our data drop. And pag na-upload yan, doon nagbabago, no, yung ating DOH website and the data that we have in our COVID-19 tracker sa DOH website. So what have been the issues, no, na encounter natin with COVID kaya? So as we reported, the server went down from September 23 to September 26. the reason provided to us was that the server already reached its capacity, no? And right now, the DICT is trying to identify what would be immediate fixes para po lumaki yung server capacity natin, and longer term, more sustainable fixes, no, para we don't experience these downtimes frequently, no? But because of that downtime, ano yung naging impact doon sa ating datos? So una, yung nabanggit ko kanina na yung mga laboratory line list from CDRS na automatically dapat nakakapasok o napupush to COVID kaya, yung term namin nire-reject siya. So hindi siya napupush, no? Hindi siya pumapasok kay COVID kaya. Kalawa, dahil down si COVID kaya, yung kapasidad natin na mag-encode doon or mag-update ng datos doon, hindi yun nangyari. So yung lahat ng mga nag-a-access dati kay COVID kaya, hindi nila ma-access during that time. So kung meron tayong bagong datos, halimbawa gusto mo na itong i-report na death or gusto mo itong i-report na recovery or meron kang gustong baguhin sa case data, hindi natin yun nagawa during the time that COVID kaya was down. And from the end then of the CSQA, yung unang process natin, which is extracting data from COVID kaya, hindi rin natin yon nagawa because COVID kaya nga was inaccessible at that time. So as mentioned kanina, the having reached ngon the capacity of the server, kumbaga, hindi niya kinaya yung bulk talaga of the data being pushed either from CDRS or yung mga ina-upload na data ng mga encoders natin, no? And it already exceeded the capacity of the server. So while COVID kaya was down, we had to think of interim solutions so that we are still able to post, no, yung ating daily top line numbers. And for us to do that, ang mga ginawa natin ay una, para malaman natin, no, ilan ang mga bagong kaso, ginamit natin yung datos na straight kinuha natin sa CDRS. So we have a separate access to CDRS. So tinitingnan natin sino yung mga pumasok na datos sa CDRS at yun ay minamanually extract natin. Yan ay ina-append o idinidikit at kinukumpara natin sa dati na nating line list ng COVID kaya. So kung kahapon meron na tayong line list, ano yung nakuha natin ngayon na mga listahan ng mga bagong kaso, positive individuals sa CDRS, pinagsasama yung dalawang yon. And much like the cleaning and the duplication process that we go through from the extract of COVID kaya, ganun din ang ginawa natin dito sa combined case line list and CDRS line list. So alam natin ilan ang bagong kaso. Kaya lamang ang limitasyon natin ay hindi kasi lahat ng datos ng kaso ay ina-upload natin sa CDRS. Kung sabihin natin, no, we have more than 20 variables in our CIF. Not all 20 variables are available in the CDRS. Limitado lamang yung nakukuha nating datos doon. So isang limitasyon natin doon, hindi natin nakikita kung ano yung sino doon yung mga recovered na, sino ba doon yung mga fatality na. That's not data available in our CDRS. And because of that, limitado lang tayo sa ilan ang bagong kaso. Limitado din tayo na kapag nireport natin ang ating recoveries, we can do time-based. Alam natin na based on previous line list, ito yung mga magre-recover na as of this date because these are the mild and asymptomatics who have remained either asymptomatic or already asymptomatic at this time and nakalipas na yung 10 araw, no, na isolation either from onset or specimen collection. So we have these two data, kaya lang yung death, hindi natin siya ma-update dahil hindi natin ma-access ang COVID kaya where death details are either updated or uploaded. So, ang naging impact nga niya, no, ay hindi natin ma-report yung ibang outcomes natin. So, kung halimbawa, meron ng bagong death, hindi natin yun na-i-report, no? O di kaya, posible kasi meron tayo mga recoveries din na na-identify by our disease reporting units na hindi na siya galing sa time-based tagging natin. Hindi rin natin yun na-i-report agad, no? And then the third, aside from not being able to capture the death, we need to take note na kapag may ni-report din kasing death sa atin, napakahalaga na binavalidate pa rin natin. So ito yung sinasabi naming validation. Even though a disease reporting unit will report that person or that case as a death, we only report those as valid deaths as yung merong kasama na date of death at meron din pong kasamang valid na cause of death, no? At ito yung mga dahilan kaya mula nung nag-down ang COVID kaya hindi tayo nakapag-report, no, ng mga deaths natin. And it was only a couple of days ago, late afternoon, when COVID kaya became accessible, na naipasok na natin, no, na ang ating encoders ay nagkaroon ng opportunity to update these death details in COVID kaya. So, and that is one of the reasons why we have delays, no, in the reporting of our deaths and why we're reporting ilan ba dapat yung nakita natin ngayon na deaths at ilan yung dapat nung isang araw pa natin na mga na-report na deaths in our top line numbers. So I think that's the end. Jolo, we'll be more than happy to further clarify.
Okay po. Thank you po, Doc Thea, for giving us updates on the downtime of COVID kaya and the interim solutions that CSCAO made in order to para magbigay pa rin ng update sa ating mga kababayan. So before we move to the open forum, may I request our media partners to please raise your hand kung may tanong pa po kayo. Tapos 2 questions lang po muna per reporter and we'll have another round of questions if may time pa po. So for the first question, let's have Caroline.
Good morning po, Ms. Thea. Ma'am, itatanong ko lang sana, because of the problems that we encountered with the COVID kaya system, in the middle of a change in alert level systems protocols, so may impact po ba ito doon sa accuracy ng magiging assessment na atin kung ano yung situation natin ngayon and kung naging effective pa itong bagong protocol?
Thank you, Caroline. No? So dito naman sa alert level system natin, ang metrics na ginamit natin ay yung dami ng kaso, no? That's one. And the second is the healthcare utilization, diba? So yung healthcare utilization, it's a different information system. When it comes to the case data, hindi siya naapektuhan kasi may access pa rin tayo sa CDRS, which is where we get the number of new cases, no? So nakakapag-compute pa rin tayo ilan ang bagong kaso ngayon, no? Ano yung 2-week growth rate, ano yung average daily attack rate. So it had no impact in the assessment or in the computation of metrics that we used in assessing kung ano yung alert level classification for National Capital Region.
Okay. And then my second question, ma'am. Ma'am, you said that nagsascan kayo ng duplicate cases. I'm just wondering, ma'am, do you include reinfection, possible reinfection cases doon sa count natin? Do you include all the duplicates na pwedeng possible reinfection? Na may na-include na ba tayong reinfection? Ilan, if ever? And ano po yung papasok lang dun sa reinfection? Ano yung duplicate na hindi sasama? Salamat po.
Thank you. Carlin, that's a very good question. This is something na tinitingnan natin paano natin siya i-assess, no? I think it has been a question previously, and it's been a challenge not just for us but even for our experts to really define what reinfection is, no? Our experts are saying kasi it should be not based on sino yung naulit lang ang positive. Kasi yan yung usual na appreciation natin, di ba? Kung nung isang linggo positive, nung isang buwan positive ka, tapos nag-positive ka uli, reinfection na siya. But our experts are saying that the RT-PCR result is just one possible basis to say na reinfection siya. What we should also consider is kung nung una, naging symptomatic siya, this time around ba, bagong symptoms ba to or this time asymptomatic pa siya? So binubuo namin ngayon yung mga posibleng definition for a reinfection. Right now, kapag tayo ay umulit na positive, hindi pa natin yan isinasama doon sa mga bagong kaso natin. Pero since nasa atin naman yung datos, posible nating i-review pa yon kung mabuo ng ating experts yung definition ng reinfection and see, no? Ilan ba yung tinatawag natin na possible reinfection. So that's something we're studying now. Kung yan ay ma-finalize natin, that's something with update our media partners on.
Thank you po, Ms. Thea.
Thank you.
Thank you, Caroline, Dr. For the next question, let's have Red.
Hello. Good morning, Dr. Thea. First question po, why does not, well, sabi niyo po na nagkaroon ng problema sa server. Wala po ba tayong option to move the COVID kaya into the cloud, or is the cloud storage already exhausted na rin po ba?
Okay. I think baka Johnny can help me better, but I think there's a physical server, no? Yung cloud or yung kung saan namin ini-store yung data na mas virtual, ito yung data warehouse na sinasabi natin. Ito yung expand siya, no? Pero we need that server pa rin kasi because that hosts not just the data in COVID kaya, pero yung processes mismo, kung paano tumatakbo si COVID kaya. DICT has actually already expanded, no, yung capacity ng server. Pero with this larger number of cases and testing na ipapasok kasi kay COVID kaya. I think yan yung challenge natin ngayon, how to either further expand that server capacity, at the same time, paano siya mas magiging sustainable kasi nga dadami yung datos. And that's something na pinag-aaralan nga ni DICT. No? And na-note lang ni Johnny kanina, actually nasa cloud na siya. Pero I think baka Johnny, you can better explain why we need a server different from the cloud. Johnny, can you go ahead and explain?
Hello po, good morning po. So again, to explain, COVID Kaya is already hosted in the cloud. It's just that it got overwhelmed because it's trying to process a lot of data. So this would mostly come from CDRS. So again, most of our data comes from CDRS lab results being pushed to COVID Kaya. So because of that, na-overwhelm siya and caused the server to go down. So ayun po. Yung solution to this, long-term solution to this would be to increase the server capacity, which is something that the ICT is currently looking into.
Thank you, Johnny. And hope nasagot namin, Red.
Okay. Here. And second question, may follow up ko lang po dun sa question ni Carmen kanina, yung tungkol sa reinfection. Right now, sa DOH case bulletin natin, out of the 2 million total cases pa na yun, kasama po pa doon yung mga na-reinfect, or all of them, the 2 million cases are individual cases na iba-iba. Wala pong duplicate po doon. Does it mean po ba na ito po bang mga 2 million na to ay 2 million Filipino individuals, or do we say na may mga instance na baka may double pa sa total 2 million cases po ba natin? Salamat po.
Sige, Red. So, yung 2 million na yun, these are 2 million unique individuals, no? Pero tulad na nabanggit ko kanina, and siguro napapansin nyo naman siya dun sa case bulletin natin, when we report new cases for the day, it's possible na may ilan doon yung natawag nga natin na fuzzy duplicates, no? So, we might be reporting several individuals na we thought to be unique individuals, but later, after validation ng ating mga ESU, sasabihin nila sa amin ay hindi. These are the same people. Kapag ganun, yun yung nire-report namin na nagbawas kami ng ganitong klaseng duplicates kasi na-validate siya na hindi pala na ito pala ay mga magkakaparehong individuals and as such should not be reported more than once.
Salamat.
Thank you.
Thank you, Red and Dr. For the next question, let's have Aiko.
Yes po, Doc Thea. Good morning po. Good morning po, John. Doc Thea, when can we expect for the system to work well again po? Lalo na po ngayon na medyo crucial po yung monitoring natin with the policy shift that we have. We started having problem po, technical issues last Friday. So are we going to expect it na maayos na po today or later pa rin po yung reporting for the daily case update po?
Yeah. Sa ngayon, tayo ay nakaka-extract na. No? So, I think there are already issues fixed by the ICT. But as mentioned by Johnny earlier, aside from this immediate fixes no, to what we have identified as technical issues with COVID Kaya, we're working with the ICT for longer term, more sustainable solutions so that if not zero, then at least we minimize these downtimes no, ng COVID Kaya. And we're able to ensure continuity, no, not just reporting of our total cases, but all case data. As of now, there's no specific timeline provided us, but since we have started seeing these technical issues with COVID Kaya, the team of Johnny and T-Squa has been working with the ICT, no, para nga mas meron tayong longer term fix para sa kanya. So, and that's why while that fix is being done, we really need to find alternative options and solutions para din tuloy-tuloy naman yung pagbibigay natin ng datos. At tama ka, yung ikalawang punto, we're sure no, that when we're reporting this number of cases, sigurado tayo na ito talaga yung datos na dapat na, or ito yung dami ng kaso na dapat na ma-report natin even if COVID Kaya was down during that period.
Kaya, are we going to expect na rin po yung timely or zero death case, death cases po today? And also, how will this also affect the reporting of positive cases, including nga po yung plan to include the results of antigen testing expected to start this week po sana?
Yes, so kahapon nakapag-report na tayo ng ating mga data on death. So yun ay tuloy-tuloy na at tulad nung ipakikita nga ay ilan ba dito yung mga dapat previously reported na at ilan dito yung dapat talaga ngayon natin na i-report. So meron na tayong death data. When it comes to the reporting of positives, it didn't actually affect yung reporting natin ng positives kasi may access naman tayo sa CDRS, no? At yun nga yung source natin kung ilan yung bago na confirmed cases natin. And then the last point, yung antigen testing, no? The antigen test right now is actually not part of the data being uploaded to COVID Kaya. It's one of the enhancements that we're asking the ICT to do para RT-PCR, pati antigen test, may ipapasok natin kay COVID Kaya. Ngayon, ito ay mga line list na ipinapasa sa atin no, ng ating mga LGUs. At doon nga pumasok yung call namin last time na we need the LGUs, our SUs to regularly submit those line lists. The team cleaning those line lists is actually also Johnny's team. So they have a separate, the same but a separate cleaning process for our antigen line list. And yun ang pagsasamahin natin later no, para malaman natin ilan ang positive on RT-PCR, ilan ang confirmed cases on RT-PCR, at ilan din yung confirmed cases natin sa antigen. At pag pinagsama natin, ilan lahat talaga yung mga bago nating confirmed cases. So it's a separate source and it's a separate cleaning process for our antigen line list.
Sorry, Dr. Last na lang po. Back to 4 p.m. regular reporting na po ba today?
Yes. Back to ano na tayo. Na meron lang talagang kailangang i-fix or i-match pa the previous days. That's why there were delays in our reporting.
Thank you po.
Thank you, Aiko and Dr. Thea. For the next question, let's have Rafael Bosano.
Hi, Dr. Thea. Good morning.
Right.
Following up lang po on Aiko's question on antigen tests, paano siya ma-factor in or talaga bang kasi na-mention po ni Yusek Vergere last week na medyo nagkakaroon ng challenge kasi manual po yung pag-input. But how will you factor this in doon sa current system of collecting data natin?
Well, it makes it more challenging for us, no? So siguro kung babalikan natin yung unang panahon na nagre-report tayo, it really takes us a longer time to clean the data that we have. But because of the more automated or semi-automated processes, kaya actually natin na mag-extract kami ng alauna ng hapon. In a few hours, may datos na tayo. So that makes it easy for the RT-PCR results. Pero doon sa line list nga, doon yung actually mas challenging. Dahil yun, aayusin natin siya dahil ang mga LGs natin, hindi pa standardized yung line list na sinasubmit sa atin. So yung mga columns niya pwedeng magkakaiba and the team has to actually reformat them, no, para mas madali nating linisin. So it can be done. It's just that it's a bit more challenging and will take a bit more time kasi mas manual talaga rather than semi-automated yung process sa antigen line list na yon. And then the last step kasi is also matching what's in that antigen line list with our RT-PCR line list and to ensure na, di ba, kung halimbawa, in-antigen ako, pin-PCR din ako, I will not report that person twice. So that's the last process na kailangan din naming iayos yung sistema para mas mabilis, mas automated yung pagmamatch na yon at pag-generate ng final confirmed line list based on both RT-PCR and antigen test results.
Okay. Tapos ma'am, last week po parang in-instruct na po ang DOH na i-facilitate po na yung mga labs na nagsasagawa ng antigen test. Tatanong ko lang ma'am if you have any knowledge kung ano na po yung usad nito.
We have already coordinated with our CHDs and with the Metro Manila Regional Task Force, no, na they need to, number one, coordinate, no, the LGs need to coordinate not just with the laboratories but also with the hospitals which may be doing antigen line list. They were tasked to consolidate this antigen line list for submission to the RESU and to the Epidemiology Bureau. Sa ngayon, Rafael, we're in that process of checking the compliance of the LGUs and also checking with the LGUs if they're already which hospitals and private laboratories have already submitted. So ayusin lang namin, Rafael, so that we can better report back, no, to our stakeholders and to the media, no, kamusta yung pag-i-ensure ng more complete and timely reporting of our antigen line list.
Ma'am, sorry po, last po may nagpahabol lang po kasi natanong. Tatanong lang daw ma'am, yung may clarifications daw po ba sa data yesterday? Parang may a few cases daw po off. Would you know kung may akong clarification?
I'm not quite sure. Can they be more specific para mas masagot namin? Siguro pwede natin balikan, Rafael, if they have more data or more specific details on that.
Let's move.
Sige.
Let's move on to Lay Alvis muna. Lay?
Yes, Doc Thea. Doc Thea, so yung reported deaths po kahapon sa bulletin, hindi pa po ito yung updated. May inaasahan pa po tayong papasok.
I think, Jolo, there will be a separate advisory, right?
Yes, we'll release after this, Kapihan.
So kahapon, ni-report natin yung mga deaths na dapat na-report natin kahapon. And as manifested po by Yusek Vergere, yung pong mga tinatawag natin quote and unquote backlog deaths, meaning ito yung mga deaths na dapat na-report natin in the previous days, i-release natin siya in a separate advisory.
So, Doc, inaasahan po na medyo malaki-laking bilang po ito since ilang araw po tayong hindi nakapag-report ng deaths, no?
Sa ngayon, hindi pa ako makapagbigay ng estimate, no, gaano kalaki. Yung datos na meron tayo ngayon, Lay, is yung nalinis natin kahapon na meron na nga tayong na-report kagabi, kahapon, at ngayon meron tayong ilalabas, no? Pero yung para sa ngayong araw talaga, yan yung generate pa ng ating team, pero no, just to put context nga, kung ano man yung numero na lalabas natin, yan yung kaya natin kinokonteksto na kung ano man yung numero o deaths na ire-report natin, ito ito talaga yung deaths na dapat na report ngayong araw. Pero yung iba dito, posibleng previous deaths, no? That's one. And ikalawa, no, yung isang ginagawa din natin ay ipinakikita natin na kung ito man yung number of deaths natin, kailan ba talaga nangyari itong deaths na to? If you noted there, even before these issues with COVID kaya, we actually have deaths that are that have occurred not just days prior, sometimes weeks. Meron nga dyan even a month or two prior para lang mapakita natin ano ba talaga yung magnitude or gaano ba talaga kalaking deaths ang mas recently or currently or mas bago na nangyari versus dun sa mga dati na talagang nangyari or na dapat na report na deaths pero ngayon lang kasi na ipasok kay COVID kaya or na-i-report natin.
Tapos Doc Thea, medyo technical pero I'm just curious paano po naayos yung technical issue sa COVID kaya?
Magandang tanong yan kung ano yung technical issue. I think more of trying to expand that server capacity. So sabi nga ni Johnny, no, dahil ito ngayon yung kapasidad no ng ating server, nagsabay-sabay kasi yung pag-push ng datos, sumabay din yung pag-e-encode natin ng datos no either from the DOH side, from all of our SU. So DICT had to find a fix na even if these systems are occurring or processes are occurring simultaneously, hindi siya magli-lead to the shutdown or hindi ma-overwhelm yung system. Siguro we'll try to craft it in a more simple manner, Lay, and then we'll get back and try to explain that in a more laymanized way later.
Okay, thank you po, Doc.
Sige.
Thank you, Lay. For the next question, let's have JC.
Magandang umaga po, JC po from TV5.
Morning.
Apo. Ma'am, medyo lihis lang po ako. The Octa research said that the Delta variant daw po might be nearing its endgame in the Philippines. Based on DOH data, are we also observing this? And is NCR ready po for an alert level downgrade? Thank you very much.
Thank you, JC. I'm not quite sure what we mean by endgame, no? But what we can say is that our data is showing that yes, Delta is indeed more transmissible. Second, based on the sequences that we have sampled, no, a large percentage of those that we have sampled are turning positive for Delta variants. Ang caveat ko lang doon ay we're getting samples from areas or from populations that are more likely no, to be positive for a variant of concern. Kasi galing sila sa mga lugar na nagkakaroon ng biglaang pagtaas ng kaso o ito kaya yung mga galing sa clusters. Pero siguro, just to put into context, no, transmission will occur and will always occur unless siguro but there are ways for us to cut that chain of transmission, no? I think that's what we should focus on. A large number of cases, we are seeing a large number of cases. Potentially a large number of those cases may be positive for a variant of concern. But what we have always relayed, no, is that we can still slow that transmission down. And that's where our MPHS comes in so that we prevent ourselves from either infecting others or from us getting infected. And the second is vaccination. So that also prevents us from getting infected or sabi nga natin, kung hindi man natin ma-prevent yun 100%, then at least no, the disease that we get will be rather than severe and critical, it will be more of the spectrum na asymptomatic tayo or
Ma'am, yun na lang pong sa is NCR ready daw po for an alert level downgrade?
Sa ngayon, hindi pa namin, ito yung tuloy-tuloy nating ina-assess. Base sa metrics na una nating ginamit para i-classify kung ano yung alert level ng NCR, nakikita natin na naiwan pa no, ang National Capital Region under alert level 4. Pero tulad ng aming na ipaabot previously, ito namang metrics ay kasama sa mga pinag-aaralan in the pilot implementation of this policy shift in the National Capital Region. And we'll see no, kung ito ba meron man tayong pagbabago sa metrics na gagamitin natin, ay ito ba ay magta-translate into a different alert level for the National Capital Region. But I think what's important to put focus on is the actions that we should be doing, no? Kung tayo ngayon ay naka-alert level 4, ang focus natin ngayon is not just the restrictions. It's actually being able to more effectively implement the active case finding so that we ensure that we find and isolate cases and close contacts immediately, that we facilitate testing, no, of these cases. And then the last is to be able to immediately refer these cases to the appropriate facility at yung mga dapat makarating sa mga hospital tulad ng ating moderate, severe, and critical cases ay talagang makarating sa ospital so that even if we have a large number of cases, we lessen the number who may be severe or critical, and ultimately we lessen the number of fatalities that we will see.
Thank you very much, ma'am.
You're welcome.
Thank you po, JC and Doctea. Kung wala ng questions yung iba, let's move on to the next round. So, Caroline, you may ask your question na.
Dr. Thea, I'm just wondering if meron po kayong info kung gaano karami yung mga possible cases of reinfection na hindi nakasama dun sa official case count. And when do you think are we going to officially include them? May-include pa po ba yung past or like hindi na rin po?
Caroline, no, tulad nung nabanggit ko kanina, I think it's not just trying to find the data or parang yung datos ng kaso ay nandun. I think yung first or yung core na kailangang masagot, not just by our country but experts, is defining what reinfection is. So parang tayo sa surveillance, meron kaming case definition, di ba? Ano ba ang suspect, probable at confirmed case. Yun, established na kasi yun. May inilabas na ang WHO, CDC. But for reinfection, wala pa kasi tayong standardized definition. Ito ba, tulad na nabanggit ko kanina, ang mga kinokonsidera ng experts natin ay hindi lamang kung sino yung umulit na positive. Pero ano ba yung clinical presentation niya ngayon kumpara nung nauna natin na nila na clinical presentation. So, pasensya na, hindi ko masagot ngayon kung ano at paano natin hahanapin, pero the data is there, no? So, but if once we have that standardized case definition, it would be easier for us to decide kung ito ba ay retrospectively hahanapin pa natin, or do we just move forward and identify who may be possible reinfections.
Ma'am, sorry, one last na lang po. I'm not sure if you can answer po, pero sasabihin ko na lang din po, just in case CMU will be able to at least release a follow-up statement later. Kasi po nung April, we asked Undersecretary Vergere about this, and she said that according to existing protocols, a person will be considered reinfected upon testing positive and with symptoms again 8 weeks after getting COVID. And for those who will test positive after 8 weeks but has no symptoms, then yung reinfection will be determined based on exposure and viral load. So I'm just wondering, ma'am, kasi back in April, the DOH said that ito na po yung parang working definition for reinfection. So that's why I would like to follow up po. When will you officially release a definition on it, and then na ma-include po siya? And then maybe how will this affect our response po? Kasi I know some people who got reinfected 8 months after their first infection but was not contacted by the local government. So I'm just wondering, ma'am, maybe it is also affecting the response because it's not part of the system. So maybe the barangay po do not consider it as a reinfection. Kaya po yun. Kasi I personally know some people who were reinfected na hindi po talaga kinontact at all po.
Sige, Caroline, hindi kita masagot ngayon ha. I-check namin to, no? So our CMU is checking on that. Pero just a comment on dun sa positive, no? Lahat ng positive individuals natin ay pumapasok kay CDRS, no? At ang mga LGUs natin ay may access dyan. Part of the mandatory reporting is that the laboratories, aside from providing a copy of the results to DOH, to our regional epidemiology and surveillance units, is also furnishing that to the LGU. So, makikita pa rin ng mga LGUs natin sino yung RT-PCR positive. And part of that is kapag nakita dapat yun ng LGU, i-check pa rin nila yan, no? Na, positive ka, ikaw ba ay dati na nag-positive, bago ka bang positive? At dapat yun, nahahanap pa rin at nako-contact trace pa rin natin. Pero thank you for the feedback. We'll check with our LGUs and reiterate, no, yung ganitong, yung polisiya natin na dapat na-check pa rin natin, no, hinahanap at ini-investigate pa rin natin yung mga lahat ng nare-receive na resulta na positive for RT-PCR.
Thank you po, Dr. Thea. Thank you po.
Welcome.
Thank you, Caroline. Dr. Thea. For the next question, let's have Red.
One question lang po. Laboratories po natin. Like yun nga po, hanggang ngayon pa rin po may mga issue pa rin po tayo sa laboratories not submitting their data. May mga pangilan-ilan, 4, 3, 5. Right now po ba, magasabi po ba natin na talaga po ba until such time as we end this pandemic, hopefully, hindi po ba natin perfect yung maraming yung all laboratories to be reporting? Kasi everyday parang may instance po yata na laging as average na 3 or 4 na laboratories na hindi nagre-report. And what is the DOH doing po to compel laboratories na at least man po mag-push ng data para at least yung data natin at least somewhat reflective of the true situation ng sa country. Yun lang po.
Okay, thank you, Red, no? Siguro one thing, putting into context that there's already a large improvement in the compliance. So, kung dati siguro we were reporting like 10 or 20 laboratories who are non-compliant with the reporting, as you've pointed out, no, there's only a handful of laboratories. Part ng ating process is, asking these laboratories why they did not report. So, we make them respond to us, no? Ano yung naging rason? Ikalawa, kung hindi nga sila responsive, no, to our query, that's where our licensing comes in, no, to file show cause orders to these laboratories para nga sila ay makompel natin na makapag-report. The ideal, of course, is that it's going to be 100% reporting. But right now, this handful, kung mapapansin nyo, it only accounts for possibly 1% of the dapat nare-report nating positive cases. And once we've actually coordinated with the laboratories, yung posibleng hindi nila na-i-report ng araw na yon, yun ang nire-report in the next few days. So eventually, there will be some delay, no? Possibly a day, usually at most a week na delay. Pero nakukuha pa rin naman natin yung mga datos na to. And again, in terms of proportion, these are very small proportions na. And kung impact niya doon sa araw-araw na datos natin, hindi napakalaki naman. No? And then, at kung mapapansin nyo, siguro last point na lang, though we report to you the number of cases daily, there's a cadence to the reporting, di ba? May panahon, we'll have these days na mababa, biglang tataas. And that actually follows, no, yung ating operations ng laboratories. Pero on a weekly basis, no, either over a week, over 2 weeks, all of these cadence, biglang baba or taas ng daily reporting, we smoothen it out, no? And we'll see a better, more reflective picture of COVID-19 across that week rather than on a day-to-day basis. So, na doon natin siya mas nakikita kapag tiningnan natin yung datos sa buong linggo.
Last na po. May naparusahan na po ba ang laboratory na or natanggalan ng lisensya dahil sa non-compliance?
I'll have to get back to you on that kung meron, Red. As far as I know, wala naman, no? Kasi once we issue those show cause orders, they do respond naman. And I think that's something that the department also, of course, has to balance, no? Of course, we want them to report. We want them to understand, no, kung gaano kalaki yung halaga na sila ang nagre-report. But we value naman yung contribution ng bawat laboratory natin. And knowing that we need laboratories to be operational so that we continue to get the data, we, as much as possible, don't want to come to a point na tatanggalan natin ng lisensya. And I think nakikita naman yun ng laboratory. Kaya once we issue those orders to them, they do respond to us naman and they correct the reporting. Yun lang, of course, we need to continue our monitoring para nga makita natin kung sino yung mga labs na kailangan either check ano ba yung naging problema, provide them assistance if needed, no? Lalo na kung baka may valid causes naman why they weren't able to report for that days or several days.
Okay po, thank you.
Thank you, Red and Doc Thea. I think that's all the time we have for the questions. Doc Thea, may closing message po ba kayo sa media partners natin at sa mga nanonood sa YouTube?
So again, salamat po, no. The department, well, we continue to improve on our processes, no. Itong mga information systems natin right now, it's not perfect, no. And I think COVID has provided us an opportunity not just to improve on our processes, but actually try to innovate and try to see na hindi lamang siya functional but efficient na processes, no. And part of that is really being open and welcoming the feedback, no, not just of our media partners but of the public. And if there are ways for us na mapaganda pa yung kalidad ng ating datos, we more than welcome that. And we're here to further clarify, mas mapaabot, no, mas mapaintindi sa ating public and to our media partners ano ba yung proseso na dinadaan. It's part of the DOH's commitment to be transparent, no, to the public and to tell them na ito yung ginagawa natin at ito yung mga dahilan kung bakit nagkakaroon tayo ng delays in our reporting. But always the goal of the department is to provide the public with quality data as well as relevant information that will guide the response ng gobyerno natin para sa COVID. So, yun lang, Jolo, and thank you very much.
Thank you po, Doc Thea. Thank you po sa CS Scout team for joining us today and our media partners dito. Thank you.
Thank you. Salamat to CMU Intermedia Partners.
Thank you po.
Thank you.
Salamat
Johnny,
po, Doc.
Thank you.